Hello, my name is Pharand, and today I'll be demonstrating IV medications done by piggyback method. So to start, we're going to take a look at our patient. So our patient is VV, our patient of the week. So she has a history of peptic ulcer disease. He has a history of peptic ulcer disease. He was admitted to the emergency department with increased abdominal pain over the past 3 days. For winning a chili eating competition, he has been diagnosed with a gastric ulcer. So to start off, I'm going to be comparing my physician's orders to my MAR, and I have compared them both, and I can see that they both match, and that I note that there's a primary of normal saline already running. So once I've compared to my physician's orders, I can go ahead and perform hand hygiene quick, and I can grab my medication from the Pyxis machine. So I've grabbed my Pantoprazole that I'm going to need, so I can do my first check. So for VV, who has no known allergies, we have Pantoprazole 40 milligram vial for 40 milligrams. It's given IV, this can be given IV it states, and it's to be given now, it has not been given yet. So I'm going to set this down and look at my drug monograph. So for Pantoprazole, it is a GI acid inhibitor, which is why they're taking it, as they have their peptic ulcer, so it is for their peptic ulcer. It can be given by a nurse or a student nurse, so I'm safe to give it. The usual dose is 40 milligrams, and it's supplied as a 40 milligram vial, and I am to add 10 milliliters of normal saline for a final concentration of 4 milligrams per milliliter. So after I figured that out, I'm going to then dilute it into 50 or 100 mils of normal saline and administer it over 15 to 30 minutes. So I'm going to be choosing 50 mLs of normal saline as they may be on fluid restrictions in this case. So I'm going to be given 50 mLs of normal saline. I'm going to administer over 30 minutes instead of 15 as the patient's first time receiving the medication, so I want to insert it a little slower. So now that I have seen that Now I've figured that out, I've also taken a look and seen it's compatible with the normal saline primary, and that some potential hazards to watch out for are going to be diarrhea and headaches, so I'm going to note those. So once I have looked at my PDM and done my first check, I can go ahead and grab all my supplies. So I'm going to grab my syringe, my blunt fill needles, and my normal saline that I'm going to add. So to start, I'm going to grab alcohol swabs and swab the top of the vials. So I'm going to grab an alcohol swab the top for 30 seconds, let dry for 15. And I'm going to grab another alcohol swab for my normal saline, swab for 30 seconds, let dry for 15. So after I have now swabbed the top, I can go ahead and set up my supplies. So I'm going to sterilely open both packages for my blunt fill needle and syringe. Again, these are used in labs, so they're not going to be ideal, but I would sterilely open it without touching it in the butterfly method, and then attach my syringe. And then I can go ahead and pull up my diluent. So again, as per PDM, for a 40 milligram vial, I'm going to add 10 mLs of normal saline. So I can pull up 10 mLs of air that I'm going to need to inject into my vial of normal saline. So I can go ahead and inject my 10 mLs of air. I'm going to pull up my 10 mLs of normal saline. So then I can see that I already have no air bubbles, so I am good. I can go ahead and I see that I have my 10 mLs that I need, and I can go ahead and inject my 10 mLs into my medication vial. So I'm going to inject it, and then pull up my air. So once I've pulled up my air, I can just go ahead and recap my medication syringe. So now I'm going to roll my medication, ensure that it's mixed and there's no sedatives left. So I can see that there's no sedatives, so it's good. And I'm going to just swab the top of the vial one more time, just in case I touched it while I was rolling it. So I'm going to swab the top of the vial again for 30 seconds, let dry for 15. Now once I have swabbed it, I can go ahead and calculate my dose while it's drying. So as per PDM, it's a final concentration of 4 milligrams per ml, so that means I'm going to need my 10 mLs to achieve my 40 milligram dose. So I pull up my 10 mLs of air, and I can go ahead and uncap it and inject into my medication. So I'm going to inject it into my medication, and then let my air come up. I'm going to pull up my 10 mLs. So now I can see that I have my perfect 10 ml dose. I can go ahead and recap it, ensure that there are no bubbles, and I see that I have my exact 10 ml dose. So now I can go ahead and perform my second check. So I'm going to be checking my medication syringe with my vial and my MAR. So I can see for my patient VV, who has known allergies, pantoprazole 40 milligrams. We have 40 milligrams, which as per PDM is 4 milligrams per milliliter. So we need 10 mLs, which is why we have the 10 mLs in our syringe. And it's again IV. This can be given IV, and we have our 50 ml IV mini bag here of normal saline. And it's to be given now, as it has not been given yet. So we're going to give this medication. So then I can go, once I've done my second check, I can go ahead and dilute it into my piggyback med. So I can start off by swabbing the top of my port. So I'm going to swab the top of my port for 30 seconds, let dry for 15. And then I'm going to just set it down sterilely, making sure it's not touching anything. I can uncap my syringe, and then I can go ahead and inject my medication. So once my medication is injected, I can go ahead and just set this down. And this will then be placed, the syringe and lymph will then be placed into the sharps container. We don't have a sharps container here, so I'll be placing it here, but in clinical it would be given into a put it into a sharps container. Then I'm just going to mix my piggyback medication a couple times, flipping it, ensuring that it is fully mixed, and then I can go ahead and grab my label that I've written. So I've written my label for my medication.
I have about 5 minutes.
So once I've written for my label for my medication and I've checked it with my MAR and everything matches, is I can go ahead and head to my bedside. So I'm going to grab all the equipment that I'm going to need for my bedside, my alcohol swab, my secondary tubing, my MAR, and then I can go ahead and go to the bedside. So I'm going to enter into the bedside. Oops, you want to drop that? So I have all my equipment. I'm going to perform hand hygiene upon entering the patient's room, and I'm going to introduce myself. So hello, my name is Pharand. I'm a student nurse today. I'm going to be giving you your medications. And then can I just ask you to verbally state your name and date of birth for me? And after they have verbally stated their name and date of birth, I'm going to ask to see their wristband. So I've seen their wristband, and then I'm going to compare it. So VV, and then the FIN 099, 099, 1211, 1211. Perfect. And I can see that they have no allergies. So I'm going to ask, do you have any allergies? No? Perfect. So everything matches my MAR. So I have the correct patients. Then now I can go ahead and perform my third check. So I'm going to be comparing my medication with label to my MAR. So for my patient VV, who has known allergies, it is pantoprazole 40 milligrams, as we had the 10 mLs of medication with the 50 mLs of normal saline. So was for a total volume of 60 mLs. So then I'm going to go ahead and look that it's to be given IV, and I have my IV mini bag here. And it's to be given now, as not been given yet, to be given now. So once I perform my third check, I can go ahead and perform some patient education here. So I'm going to state to the patient that today they'll be receiving pantoprazole, which is a GI acid inhibitor. So some side effects they might experience are going to be possible constipation, possible headaches, or dizziness, any lightheaded. So if you feel anything like that, just let us know. Feel anything out of the ordinary or off, just hit that call bell. So then once I have performed patient education and I've understood the patient does have the right to refuse the medication, but in this case they're good to go and they would like to receive the medication, I can go ahead and prep my stuff. So to start off, I'm going to look at their IV site so I can assess their IV site and see that there's no complications. I'm going to be looking for phlebitis, erythema, any IV complications, and I can see that there's none and everything is infusing well. Are you in any pain? No, there. So they don't have pain there, and I can see that all my clamps are open and everything is infusing properly. I can check my pumps that the primary rate is at 25 as per the orders by the doctor, and then I can see that I have my primary bag here of normal saline, which is compatible. So once I've ensured that all the ports are open, everything is infusing well, I can go ahead and set up my medication. So I'm going to start off by grabbing this clip and lowering my primary bag. So once I have lowered my primary bag, I can go ahead and set up my secondary supplies. So I'm going to start off by grabbing my tubing, noting that both ends are in sterile caps, so both ends are sterile. I can go ahead and start off by spiking my mini bag. So I'm going to start off by removing this spike here, and then this cap. And I can go ahead and sterilely attach the two.
Once that's running, I'm going to make sure I set the callback so I can wash the 50 I'm going to make sure there's 3 drops running.
And then once this has been spiked properly, I can go ahead and hang it up. So I'm going to hang up the medication, and then once I've hung it up, I can go ahead and attach it to my primary. So I'm going to be choosing the pump before the port before the pump, as so the medication can be regulated by the Baxter pump. So I'm going to grab an alcohol swab here. I'm going to open it. I'm going to grab my alcohol swab. And again, throw that in the garbage, swab for 30 seconds, let dry for 15. Then once I've swabbed that, I can go ahead and unclip this and attach the two sterilely. So I'm going to sterilely attach the two ends, and then I can go ahead and back prime. So I'm going to lower my primary bag, open up the clamps, ensuring that I'm back priming. So once I have back primed and everything is out and I have finished back priming, I can go ahead and see my drip chamber is half full. I can set up my secondary bag. I'm going to program my secondary. So I can go my secondary, my rate I've included as per PDM is 120 mLs an hour, as there's 60 mLs in the half an hour. My total volume is going to be 60 mLs, and then I'm going to confirm my secondary. So now it's going to confirm secondary, I can start. So now that my secondary is infusing, I'm going to watch for 3 drops, ensuring that the medication is infusing, so I can see that the 3 drops have came out, so I know that my medication is infusing. Again, there's no air bubbles, and then I can go ahead and label my tubing. So I'm going to label with my name and date, so I know when the tubing has to be changed, and I've seen also that on the primary they have their tape when it has to be changed. So now that I've ensured everything is running, I can go ahead and quickly assess my IV site, make sure, and again ensure that there is no complications and they're having no pain. I can go ahead and document. So I'm going to document in my MAR with my initials and my time that the medication was given, and once I have documented that, I'm going to do an exit safety check, make sure that bed lowers, everything, call is in place, there's no hazards, and then I'm going to again say if you experience any of those symptoms, just let us know, and then I have documenting in any ins and outs or flow sheets that